Hi, my name is Dr. Darren Bowlby, and I'm a chiropractor here in Longview, Washington for the last 25 years. And for the last 10 years, I've been specializing in treating people with peripheral neuropathy. And since that time, we have been the premier neuropathy treatment center in Southwest Washington. And what I'd like to do today is talk to you a little bit about how to get lasting relief from pain, numbness, burning, and cramping without drugs or surgery. It's about a 20-minute webinar that will answer some questions, what is neuropathy, and exactly what we can do to help treat it, all right? So, who here would like to feel 60 to 100% better? It is possible. As a matter of fact, so many patients after they've treated with me, they just can't believe what a difference this has made. Now, let me step back and explain how I got into this. So for 15 years, I treated patients for neck pain, back pain, knee pain, and just traditional chiropractic. And then one day my father visited me and he said that he was diagnosed with diabetic neuropathy. Now, at that time, I didn't even know what diabetic neuropathy was. And so he explained to me that basically, he was developing burning pain in his feet and his balance really started becoming affected. And that the only treatment for it was medication. So as a chiropractor, we specialize in treating these conditions drug-free as much as possible. And so I started researching and trying to find out who treated neuropathy naturally. And I found that there was a group of doctors, primarily in Europe, that treated this, and they were called functional medicine doctors. And they comprised of medical doctors, chiropractors, and naturopaths. So I started attending seminars and learning how to take care of patients with this. And so I could treat my father and then anybody else that would suffer with this. So after attending hours and hours of lectures and learning and studying how to treat neuropathy, one of my very first patients besides my father was a young mom. And her husband called my office and said, listen, do you treat neuropathy? Now it just happened that this person would be my very first neuropathy patient. And I said, it just happens that I just started getting certification on how to treat people with this condition. So I had them come in, and she was 32 years old, 2 little children, and was on a lot of medications, almost 18 medications, and primarily it was a lot of pain pills and anti-inflammatories and antidepressants. Matter of fact, she was so miserable that she spent most of her day laying on the couch because she could not walk. And so we started taking care of her. And over the weeks, we started noticing a change. And the biggest change came in about 4 weeks, where she started realizing she didn't need all of her medication. And she was able to start cutting down on her morphine and her Percocets and those type of drugs. And by the time she finished her program, she was down to 2 medications. And it was so amazing that it gave back her life. Can you imagine being a mom on that many drugs? Or being a wife, she just couldn't do it. So that really sparked my desire to help patients with this. And so routinely, patients coming into my office would improve 60, 70, 80%. If you're watching this right now, how would your life change if you felt that much better? It would probably change your life in an incredible way, wouldn't it? So let's talk more about this condition, neuropathy, okay? So we're gonna talk about how you can get relief, because most of the time, you want relief so you could be with your other family members, so that you could participate in family functions, so that you could go on walks and those type of things, all right? So you can't do that though if you're having pain and numbness in your feet. Now, one of the biggest problems that we see patients with is numbness in their feet. And matter of fact, they describe it as walking on pins and needles. Sometimes people describe it as walking on marshmallows or on pebbles, all right? Some experience burning in their feet, especially in the evening, getting ready for bed. As a matter of fact, their feet will feel so hot that they'll reach down and feel their feet, and it'll actually be cold. Some will experience hand pain. Some will experience back pain. And people can experience joint pain also. And the most common joint pain I see with peripheral neuropathy is knee pain, okay? So after today, what I hope you all understand is the challenging truth of standard treatment. what could be causing your pain, and the documented dangers of neuropathy. And then I want to talk about some proven methods for creating lasting relief. And then some simple steps you can take to get on the road to feeling great again. So at the end of this presentation also, I want you to stay till the very end, because I will be giving a special offer of how to see whether you're a good candidate for our program or not, okay? So the first question, that I ask patients is, are you tired of taking medications? Because what I found is that with most of my patients, they're averaging over 18 new prescriptions per year. Matter of fact, they'll take out their Sunday through Saturday pill box and AM and PM and fill those things up at the beginning of the week. And it's just an enormous amount of pills. And every one of my patients would rather not take that medication, okay? So 18 prescriptions per year is huge, all right? And what's interesting is over the last decade, we've been seeing an incredible increase in diabetes, heart disease, and neuropathy, all right? Matter of fact, our healthcare as a nation is not improving and getting better. Matter of fact, we spend trillions of dollars every year trying to help people with their health problems. Matter of fact, it's $3.2 trillion, and that is just way too much. And so we're not addressing these problems in the correct manner. And this was back in 2015 for Medicare and Medicaid services. Imagine how much greater it is now, all right? The US consumes 75% of the medications produced in the world. 75%. Now the question is, what is the population of the United States in the world's population? It's only 5%, yet we consume 75% of all the medications. And isn't it interesting that we have the most doctors, the most hospitals, and the most money, yet we are not the healthiest people in the nation. Matter of fact, we rank number 37 in this World Health Ranking. And why is that? You would think we would be in the top 10, right? Well, there's an interesting phenomenon going on. And the average home has 2 washing machines. We have a clothes washing machine, obviously, and we have a brain washing machine, the television. And what do I mean by that? Well, there is a marketing term called social conditioning, and has a direct effect on us as human beings. Matter of fact, what it's doing is, as you watch a television show, all the commercials coming out, what are most of the commercials about? Different medications, right? And we're being highly persuaded by these pharmaceutical companies on taking all these pills. Matter of fact, these companies are spending in excess of over $4.5 billion a year. So they're trying to persuade us to take these medications. Why is that? Primarily because the more medications we take, the more money they make. And yet you would think if we're taking all these drugs in ourselves, that we'd be feeling a lot better, that diabetes would be going down, that heart disease would be going down, that neuropathy would be going down. And the fact of the matter is they are not, okay? And so one of the most common drugs when it comes to neuropathy is Neurontin. Now, most of my patients, when I ask them, do you even know what Neurontin is? And they're like, no, not really. And what it is, it's an anti-seizure medication. It slows down your brain so you don't feel your feet, all right? Let me say that again. It slows down your brain so you don't feel your feet. Matter of fact, you don't feel anything. And some of the side effects is that you feel tired all the time, you're sluggish, you have focus problems, you can't remember anything, okay? And it does not stop the progression. And it's even been shown to cause suicidal thoughts. So Neurontin is a very dangerous drug, and more research is coming out saying that people that are on Neurontin for long terms, that the synapses in the brain, the connections of the nerves are actually diminishing, and they're not regenerating because of this drug. Another one is called Lyrica, and Lyrica is also an anti-seizure medication. It slows down your brain so you don't feel your feet, and it does not stop the progression either. It's just like Neurontin, all right? And matter of fact, these drugs were never designed for neuropathy in the first place. So it's really interesting. For the most part, we are treating ourselves worse than our vehicles, worse than our car, all right? Now, what would you do if you saw the check engine light, right? Well, you'd go to the professional, you'd go to the mechanic, right? And you would hopefully get diagnosed of what the problem is. Or some of you may actually, want to avoid this altogether, so you take some black electrician tape, get some tape, and you cover over that, right? Well, that's not good either. So, when you're having some of these issues that we mentioned earlier, the burning feet, that is a fire alarm. That is an alarm to your body saying there is a problem. And when you take medication, all you're doing is masking those symptoms. You're not doing anything to help heal that, all right? So it's like just, cutting the wire to the fire alarm so it doesn't work anymore, all right? So what is peripheral neuropathy? It's damage to or disease affecting the nerves. It can be associated to your feet, your legs, your arms, your hands, and your back. And it's quickly becoming one of the most common chronic diseases in the US. 8% of the US population, or about 24 million people, suffer from peripheral neuropathy. And it can occur at any age. My very first patient was about 32 years old, but my most common age seems to be about 72 to 76. Yet these people have it for the 10 years previously. It's just getting to the point now they can't walk, all right? And 30% is diagnosed to diabetes. All right, what are the 7 most common warning signs of peripheral neuropathy? Well, the first one's numbness in your feet, burning pain, cramping, sharp electrical pain, prickling or tingling, balance problems and falls, and you can't sleep. And if you can't sleep, you can't heal. And I hear so many people tell me that, they sleep for 3 or 4 hours at a time, and then they have to get up because their feet are so hurting them or numb, okay? And so when we start talking about neuropathy and nerves, what I like to tell people is that the neuropathy is like, it affects the insulation around the nerve, just like a regular household cord, where you start getting frayed insulation around that wire, okay? And so what I get asked are, what causes it, all right? So not in any really particular order, but 30% of peripheral neuropathy is due to diabetes or pre-diabetic. It can be to poor circulation. It could be due to toxic exposure, such as chemotherapy. It can be back and neck problems. It can start out as a herniated disc, spinal stenosis, post-surgical, autoimmune diseases like thyroid or something like that, infections, alcohol abuse, liver disease, kidney disease, and even several medications and pharmaceuticals can cause it. Statin drugs being one of them, lowering your cholesterol so badly that it can actually cause diabetes, which is unbelievable, and neuropathy, okay? Now let's talk about the science a little bit. Now, on the left, nerves are called axons. And on the left side of the chart, you'll notice that these axons look really big, and they're called large diameter afferent fibers. Now, these fibers are used for your muscles, innervating your muscles, for balance, for standing, and this type of thing. So when these nerves get damaged, what are some of the side effects you may be experiencing? Well, it could be that you have horrible balance, that you can't stand for any length of time, that you're shuffling from one place to another, okay? And if you cannot stand very well and then you can't walk very well, guess what may happen? You may fall, all right? And that could be very dangerous. The leading cause of injury death for patients age 65 over are falls, all right? 20 to 30% suffer moderate to severe injuries. 10% of these falls are fatal. And it's a leading cause of injury death over age 65. And I've had several patients of mine that have fallen and actually died because of that. And patients that wanted to start care and they've fallen even before they could start care and actually pass away. Very tragic, very sad, okay? Now, the science, let's go back to the axons again. Now there's 7 major axons that control 9 major functions, all right? Now, the nerves on the right side are the smaller one. They're called small diameter afferent fibers. Now, what do these fibers do? Well, these are the ones that are pressure. They sense hot and cold, pinprick, temperature differences and stuff like that. So when these nerves start getting damaged, guess what happens? You start getting numbness in your feet. You can't feel them very good. You can't, hot and cold, you really don't feel very good. And so this can be very dangerous. And here's the reason why. One of my patients who had small diameter afferent nerve damage got up in the middle of the night and smacked his foot on the corner of the bed. So hard that he actually broke the skin and was starting to bleed. Now he didn't know it, he didn't feel it, so he's laying in bed and he wakes up the next morning and he looks down and there's blood all over his sheets, all right? And it's like, oh my God, what happened? And then he looked down at his foot and he noticed that it's already turning black and purple, and he went to the hospital, and within 2 weeks, unfortunately, he had to amputate that foot, okay? And he came to my office because he was like, I cannot lose my other foot. And so he needed to see if we could help him. And what's very serious is that when it comes to amputations, each year in the US, there are about 86,000 diabetes neuropathy-related amputations, one of the most common, most feared complications of the disease. And I mean, just imagine the feeling, that sense of hopelessness that you may feel at the prospect of actually losing part of your limb and mobility. And I've had patients come in with toes missing and because of this. So it is very serious, okay? Matter of fact, it is so serious that when you can't feel your feet, when you're driving, you can't even feel if your foot is on the gas or if it's on the brake. And I've actually had a patient drive through a storefront window because she thought she was putting her foot on the brake and it was the gas. So this can actually cause serious, not just for her, but for those around her also, okay? So what are your choices? What can you do? Well, one choice is to do nothing. And doing nothing, just, what's gonna happen? Most likely get worse. The second choice is you can go to your primary care doctor, which most of you have, and then get referred to a neurologist. And most of the time, what do they say? Well, you do your nerve testing, nerve conduction velocity test, and they tell you, yep, you have neuropathy, so they prescribe Neurontin or Lyrica or more medications. Or they tell you nothing can be done or you have to live with it, okay? Well, just living with it is gonna do what? Most likely, you could end up in a wheelchair, a walker, losing your foot, losing your toes, and that's just not good, okay? Now, there is good news, and this is where I get excited because the National Institute of Health says peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed, all right? So, there's 4 key steps to feeling better. The first one is to rejuvenate these nerves by increasing blood flow, okay? The second one is you have to stimulate these nerves again. Third one, you have to activate these nerves through therapy. And the fourth one is you have to decrease inflammation, okay? Now, I want to talk about before I tell you specifically what we do in our office, I want to talk about some things you can do at home. And one of the most effective treatments for home therapies is you want to get 2 Tupperware containers large enough so that's about 3 inches deep, 4 inches deep, to stick both your feet in it. And what you do is you fill one up with hot water, 104 degrees, you fill the other up with ice cold water, putting ice cubes in there and really getting it cold. And then what you do is you stick both your feet in the cold water for up to 5 minutes, and it's hard at first. And then at the end of 5 minutes, stick them right back into the hot water for 5 minutes and repeat that 3 times. That will just start this cascading effect of increasing this blood flow into your feet. And it works, all right? A couple other home remedies is Costco actually sells these Medi massagers. They're foot massagers. And you want to put your feet on this high vibration foot massager. And what that's going to do is going to stimulate your large diameter afferent fibers. And the third thing you really want to do, we've got to decrease inflammation. And the number one way of decreasing inflammation is cutting your sugar. Sugar in your diet is like acid on your nerves. It's a highly and very inflammatory substance. And now I just don't mean table sugar, I mean sugar that is found in carbs and alcohol and those 2 things. So if you can start doing these 3 things, you will notice some improvements. Now in my office, we don't use those things. We actually have high-tech therapy equipment and these type of things. The first one is how do you increase blood flow? We use a low-level light therapy to increase blood flow. NASA started this they came up with this program or this technology 20 years ago, and has been refined to be very, very effective. One of the other treatments that we use is called extracorporeal shockwave therapy, and we will use this on your feet, and this will regenerate tissue. It's called angiogenesis. It will help regenerate blood flow. It will help stimulate and increase new nerve endings, and it's a highly effective therapy. We want to increase the installation material around that nerve, just like that basic household cord that was broken, all right? Now there's other things we do along with that. We have several additional therapies. I don't have time to get into it right now, but imagine for a minute sleeping through the night peacefully, walking with confidence and feeling steady again, taking trips, enjoying family outings again, and feeling like you're 10 years younger. It is possible, and I get told this every day in my office. All right, so why do you want to feel better? It's the ones you love, obviously, right? You want to feel independent, you don't want to be taken care of, and this is why you want to feel better, right? To be with your families. So where do we go from here? Well, who should come to see us? If you have any of these 7 symptoms, the numbness, the burning, the cramping, the sharp electrical pain, prickling, tingling, balance problems and falling, can't sleep from foot pain, you need to come and see me. So what are the simple next steps? Well, at the end of this webinar, there's going to be a place for you to sign up, all right? So you want to reserve your spot. You want to get your consultation, and we're going to evaluate what's going on, and then I'm going to recommend treatment plan. And if you're a good candidate for this, I consult with 40 patients a month, and unfortunately can only accept about half of them because they're too far gone with neuropathy. And I don't want to give false hope, and I don't want to, spend your money if it's not going to work, okay? So, during this, when you come in for this examination, I'm going to do a 16-point advanced neuroqualifying assessment. We're going to do thermal imaging picture of your feet. We're going to do a blood flow measurement of your feet. We're going to do a balance test, and if I feel like we have to x-ray your spine, your back, we're going to do that if it's necessary, okay? You need to bring the person closest to you. And the reason is that I want them to see how you're feeling. And then sometimes they will actually explain to me what they notice with their significant others. Now here's the biggest thing, you guys. Neuropathy is progressive and gets worse over time, so you do not want to wait. So click on the form on the bottom, schedule your appointment. Our fee is normally $376 to get this test done, but for this program, we're doing it for $49. Thank you very much. I hope to see you soon.